Macmillan has always, historically, in our 99-year history, been about innovation, whether it was helping kickstart hospices or palliative care within the National Health Service or the breast cancer nurse, let's say. But what we're interested in at the moment is making sure that we support people in the community to live as well and as happily at home as well as being looked after in the acute sector in hospital, basically. So it's about getting both right, and I think our view at the moment is that the real innovation which is needed in cancer to look after those 2 million people who are living with a cancer diagnosis is to get it right in the community. There are 2 million people living in the UK with a cancer diagnosis, and in 20 years' time that's going to be 4 million. So more and more of us will have cancer. Now, what we need to get right is make sure that we support people to live as well as possible, as long as possible, at home in the community, which is where they want to be. Cancer patients don't want to be in hospital. So the challenge for the future is to get it right in the acute sector, in the NHS, but also to get it right in the community and make sure people have the emotional and the practical and the financial support they need, as well as the clinical and medical support. As people live longer with cancer and they live longer at home with cancer, we need to make sure the support is in place. So let me give a few examples. One, for example, is when people get to the end of treatment, what they need is perhaps an exercise program, not necessarily a clinical intervention, but something to get them up, mobile, functioning again, so that their confidence returns, their fitness returns, and then they're ready to go back to work. So another example is around work. If we can help people to get back to work properly by working with their employers, working with them, with their trade unions, then obviously their financial situation is so much better, and we avoid a lot of the problems which we know cause difficulties for councils when cancer patients lose their home and then bounce back into the housing lists because they haven't been able to afford the mortgage. There's some things we need to get right in that relationship between health, social care and living in the community. For example, we've some great partnerships with Durham on providing benefits advice so that when people get ill, their financial situation is sorted and that burden is taken away from them. Another example is in Bournemouth, where we're working with the council leisure services so that exercise programs are provided to people coming to the end of a cancer treatment so they can get that fitness, confidence back and then go back into work. So there's some very practical things we do, as well as working together at a policy level, which is particularly important in England at the moment with the new Health White Paper. So if we can partner as SOLACE, as local authorities and as Macmillan Cancer Support and get all of that right, then we will be able to deal with the 4 million people living with cancer, and if we can get it right for cancer, we can get it right for everything else as well.